everybody. Okay, today this is going to be lesson 14. Welcome to the lesson. And this is the health and wellness of older adults course, just in case you didn't know. So today in this lesson, what we're going to be looking at is long-term care. The moment you've all been waiting for, or not. Well, I mean, unless it is. It might be, because long-term care, this is when we get into assisted living and senior centers and all that stuff. Okay, so it might be kind of a long one. Sorry, but let's just hurry up. Let's get into it. Okay. Okay. So first of all, what is post-acute care? Okay, so first of all, what is post-acute care? So this is that type of care that happens following like a hospitalization for maybe an injury or an illness, or many patients require continued medical care, especially when they do go into the hospital for maybe a chronic illness or an injury or even like an infectious disease. Okay. So a lot of this care, post-acute care, can be done like in the home or in a specialized facility, and it can be a range of medical care services that support the individual's continued recovery from the illness or management of their chronic illness or disability. Okay, so the Affordable Care Act actually requires a smooth transition for patients when they're, during the post-acute care process. Okay, so there is a lot of attention that is needed to avoid hospital readmission, and in order to help that effort, okay, to have some sort of like incentive to make sure that physicians and these facilities are providing quality care so that the patient doesn't have to be readmitted. The ACA actually put where is it? They're like medical. There are going to be penalties, like financial penalties, like fines and whatnot, for patients that have to be readmitted into like a hospital or some sort of facility within 30 days of their discharge. Okay, so that provides like an incentive to make sure that physicians and healthcare workers and all these facilities, they're not just focusing on turning patients over, but they're trying to provide quality care so that the patient doesn't have to go back in. Okay. So there's a lot more to learn actually about care transition and to improve the outcome of care and quality of life for individuals and their families. But we are right now. So what is long-term care? The scope of long-term care is super wide. Long-term care can include institutionalization, okay, but it can also include home and community-based services as well. So long-term care is so much. There's so much that fits into long-term care. So here are a couple, examples and things that you may be already familiar with. So long-term care can be nursing homes, rehab hospitals, skilled nursing facilities, home health agencies, assisted living facilities, other long-term care facilities or long-term care hospitals, long-stay hospitals, things like that. Okay, so long-term care facilities, they're going to provide medical and personal care services. Okay, long-term care facilities are the ones all showing up as examples right here. Okay, these are long-term care facilities. This is institutionalization, okay, of the patient. Okay, so they can provide medical and personal care services. Personal care services, these are the type of services that are like, helping the patient get dressed, shower, helping them with maybe house cleaning, any kind of errands or chores or things that they have to do on a daily basis, maybe helping them move from the bed to their wheelchair, things like that. Okay, personal care services do not require the caregiver to be licensed, okay, or anything like that. It's not going to be something that requires any kind of intense medical care services, nor will personal care level services be paid for by Medicare. Okay, Medicare is not going to touch that. That being said, the medical services that are provided at these facilities, those ones are going to be provided by licensed practitioners. If it's a facility that provides medical and personal care services, then this facility is definitely going to have to be licensed by the state and all of that. They're going to have nursing care as well and a physician supervision. And those type of services, the medical side, medical services will be covered by Medicare. Okay, so so to people who are unable to manage independently in the community, this is, this provides service to them. Okay, each year over 4 million Americans are admitted into a long-term care facility. Okay, so service provided in long-term care facilities. There may be assistance with a variety of different things. Like, I think we covered a couple things on the last slide, but here's kind of a list of things that can be provided in a long-term care facility. So there can be provided managed care, management of your chronic diseases, if you have chronic diseases, management of your injuries, management of physical, cognitive, and mental disabilities that you may have, and then assisted daily living activities as well. So this part would be like the personal care level. So dressing, bathing, toileting, instrumental activities, being able to take your medication, being able to clean up after yourself, cook your food, and other general health maintenance tasks, right? So what happens in a long-term care facility? 1 to 3 million serious infections occur every year in a long-term care facility. Okay, infections can include urinary tract infection, diarrheal diseases, antibiotic-resistant staph infections, and so many other infections can happen. Okay, this is going to result in hospitalization. It could lead to death, and as many as 380,000 people have died of infections that they contracted out of their long-term care facilities. Okay, every year. That's a lot of people that die of infection from just being in a long-term care facility. There is definitely a need to help prevent these infections, okay, by dialysis safety, injection safety, hand hygiene safety, use of protective gear, tracking on all data on long-term care facility infections, and things like that. So long-term care funding. How are long-term care facilities funded? Okay, so long-term care facilities, for this whole country, every year the cost is about $211 to $317 billion. So it's a very expensive industry, right? And most of this is funded by Medicare and Medicaid. Okay, remember how we did kind of discuss previously that a lot of older adults are just low income? So many of them qualify for Medicaid in addition to Medicare. So of course they're going to qualify for Medicare, but a lot of them also qualify for Medicaid so they can be dual beneficiaries, and that helps tremendously because, like I said, Medicare is not free. Okay, so Medicaid will help cover a lot of the out-of-pocket costs. In addition, Medicare will only cover those services that have to do with medicine, psychiatry stuff, and rehabilitation. Medicare will not cover things that have to do with personal care. Okay, so any kind of just regular assisted living stuff, custodial care, personal care, those kind of things, it's not going to cover that. However, Medicaid usually will. Okay, so something to think about. That's why it's really good to have both. In addition to that, we also, the role of the American Hospital Association has 5,000 member hospitals and health systems, and it also has over 3,300 post-acute care providers. Okay. So, the main goal for the American Hospital Association is to help coordinate a lot of the acute care hospital services and post-acute care provider services in order to improve the overall quality and reduce total health spending for older adults. So who needs long-term care services? Long-term care services are not exclusive to the older adults. Let's just be clear about that. There are many other patients in our population who do require long-term care, but just for the sake of argument, since we're talking about just older adults, okay, within the older adult category, who needs long-term care? And so of those, usually once you hit 75, you start needing assistance in some way or another. Okay, so it may not necessarily be that you have to go into an assisted care living facility, but you may require some home-based services, just a little bit more assistance in your life. Anyway, of course, those with Alzheimer's, dementia, and any kind of cognitive impairment as you start to age will definitely require long-term care. Those who do not have caregivers or informal caregivers, meaning your spouse or your family members or even close friends, relatives, whoever that you have, if you don't have anyone in your life to help you on your daily basis, then you would definitely need some sort of long-term care service at a certain point. Then also those who cannot groom themselves, those who can't do basic living activities, and those who are very frail. So first of all, many ethnic older adults tend to not really use many long-term care services. My take on this is that most ethnic older adults tend to live with their family. Sorry, so most tend to live with their family and not really take advantage of other other long-term care services. Many older adults might feel that it's just not who they are, that's not that if they use any kind of long-term care service, then they're they're not connected with their family, they don't get to be with their family or anything like that, which of course isn't true. There are other cultural reasons for why many older adults may not really use long-term care services, and they may also not know exactly what long-term care services may help them. Okay, a lot of reasons why many ethnic older adults don't always utilize many of the health care services that are out there that they would qualify for is because they just don't know that they exist, they don't know that they qualify or anything like that, and they just kind of feel well, that's not for us because I have my son to take care of me, or I have my kids to take care of me, or whoever is in their family. And so anyway, but then other non-ethnic older adults tend to start moving away from family care once they hit a certain age. It's kind of like a trend, I guess. They tend to move more further away from their family care, and they start moving towards formal care or other independent living options. Okay. Then of course we have that increased life expectancy of our baby boomers. We have many baby boomers that are going into retirement now, and then once they start to get even older, they're all going to start using long-term care services. And since we have a longer life expectancy, they're going to be on long-term care services for a longer period of time. Okay, so we do kind of have a need right now to prepare for what's going to happen in the future when our older adults start needing and having to utilize a lot of the long-term care services that are available. So funding sources for long-term care. Like I've said, a lot of the funding for long-term care services is done by Medicare and Medicaid. Medicare is very limited. So what Medicare is really, the only types of services that Medicare will pay for is anything that has to do with medical or like psychiatric care. Also, Medicare will cover rehabilitation and things like that. So if basically the basic concept here is, if you're wondering, whether Medicare will pay for it or not, is if it's a type of service that requires a licensed professional. Okay, if it requires a licensed practitioner, most likely Medicare is going to pay for that. If it does not, Medicare is definitely not going to pay for that. Okay, so Medicare is not going to pay for any kind of personal or custodial level care services at all. Okay, only rehabilitation and higher. So rehabilitation, skilled nursing facilities, and acute care, it will pay for, but it's not going to pay for anything under that. Anyway, Medicaid is the largest public funding source for long-term care services, because unlike Medicare, it's not as restricted, surprisingly, right? But there are many services, especially even home health or home-based and community-based services, that Medicaid will actually pay for or cover, or partially cover at least. So Medicaid actually helps a lot with long-term care services, especially for the older adults. And then of course there's private long-term care insurance. There's Medigap. There's private long-term care insurance that you could have purchased a long time ago. Some employers also will put long-term care insurance into your benefits package, and then you have it. So that's also really cool. And with those who have private insurance, this will help cover a lot of those services that really are not that Medicare is not going to cover. Okay, so this way it helps you out a lot, because who knows, maybe you're not going to qualify for Medicaid, or or have the cash to pay for a lot of the different comforts that you really have grown accustomed to throughout your life. Okay, so having private long-term care insurance will definitely pay off in the end. Okay, so some other sources for long-term care will be Social Security, there's community support, and also Veterans Affairs. In addition to that, there are also, the government has issued a lot of block grants and given that to the states, and allowed the states to kind of allocate that toward older adult long-term care programs. So sometimes you see the Older Americans Act grants that the states will, or that the federal government has given to the states, so the states can allocate that towards their long-term care programs, and things like that. Okay, so family providers of home care. So the single most important consideration to determine if a frail older adult can live at home is if a family member or a close friend can be a caregiver. Okay, so adult children or spouses are usually caregivers. There are cultural differences in family care, and especially among a lot of ethnic older adults in those situations. This kind of goes back to like how many, since there are a lot of cultural differences, many ethnic older adults stay within their family, okay, as they get older, whereas a lot of more American adults will not necessarily do that. They kind of like they kind of move a little bit further away from the family and utilize a lot of long-term care services. So But when you do receive care from your home, from whether it's from your family members, your spouses, your relatives, friends, this type of care is called informal care, okay? Because there's no reimbursement for this whatsoever. And that being said, this can become physically and emotionally and even financially hard on the family over time. And I think that's a huge reason why many Americans, a lot of like more non-ethnic or foreign-born older adults usually think about, okay, well, I have to be more independent and I need to find my own services. Okay, I need to be able to get more formal care providers and have more formal care services for myself instead of depending on family. Okay, so since it can be more, being a caregiver can actually be very difficult, especially if you are an informal caregiver, okay, meaning that you are probably a family member, a friend, spouse, maybe your child, a relative, whoever you are, you're providing care for someone, okay, free care that's not going to be reimbursed, okay. So there are a variety of different types of formal support that can be given to those caregivers, okay, because it can get emotional and physically hard and even financially difficult. So there are a lot of educational programs out there to help assist caregivers. There are support groups, there are financial support and legal support that they can seek out as well as case management, which may help assist the caregiver in figuring out exactly, what's going on with, or how they can manage their older adult and their care. Okay, and then finally there is respite care. So this is like actual temporary relief from those duties that they have to do on a daily basis to care for their older adult. So this can just be temporary, infrequent relief where maybe they can drop, and this can include like adult daycare or anything like that, where someone might help provide services while the caregiver can go out and get some fresh air, have some time alone to gather their thoughts or meditate or go to work even, or whatever they need to do. Okay. All right, so domestic older adult abuse. What does it include? What's abuse? Well, domestic abuse for older adults can include physical, psychological, sexual abuse, also financial exploitation and neglect. Okay, so it is very difficult to actually define and collect data on abuse. It's not always reported. It's not always easy to spot. Frequently, a lot of abuse will happen to women and those who are over the age of 80 because they are a bit more vulnerable. Okay, abuse happens because of long-term habits, habits of behavior. It is not based on really the stress of caregiving alone. It might stem from something else, in the past, and the relationship between those two. So signs of abuse can be attributed to aging though. So, all right, so self-neglect. This is kind of a debate, because many older adults, they might not want to be compliant in a lot of the things that they need to do to take care of themselves. Okay, and it should, on one hand, you want to say, well, people have the right to live as they please, but at a certain point, are they really doing what's best for them? Are they in their right mindset? Can they really determine what's best for them? Do you want to allow them, if they choose to deteriorate, do you want to just allow them to do that? or what? So it's kind of like, what's the right answer here? Because society should also like assumes the obligation to ensure that older adults are safe and that they're taken care of and they're keeping up with their treatments and their services or their health requirements and things like that. So it's one versus the other. Is there a balance, or is there a rule, or is there something that we should we just say forget society's obligation to ensure safety, allow the older adult to live as they please? If they seek help, they seek help. If they don't, they don't. What's the right answer? Okay, so home care and home services. So now we're going to look at home health. So this includes like skilled services, like nursing, skilled nursing services, and other medical services, and personal care services. Okay, so Medicare encourages people or older adults to use home health services, and it's because it's way less expensive than using institutionalization. Okay, and think about it, when you hospitals, institutions are so expensive, okay, like because the hospitals, they have to pay for, not only do they of course have to pay for your services, whatever you require, but they have to completely staff that room. They have to have administrative staff, CNAs, nurses, a physician supervising the whole thing. So everyone is going to require to get paid a lot of money, right? Not to mention the utilities that it requires to, all the utilities, the electric, the water, the even the rent or the mortgage or the payment for the real estate, the space that the room is in. Then there's food and everything else that goes in to institutionalization. So it gets very pricey. Okay, so if Medicare doesn't have to pay all that, of course they don't want to pay all that. Okay, if you can receive your services, your treatments or whatever in the home, that is way more cost effective. Okay, so home health services. Well, with home health care, there are the personal care services, and then there's going to be the skilled nursing services. So the home health services, this is more like the personal care service, personal and custodial level care. This would include homemaker aides, people coming in to help you with housekeeping, shopping, maybe running errands, things like that. Also with it would include home health aides as well. So just like someone that would come in and help you with bathing, also your taking medication, eating, cooking meals, stuff like that. Okay, Medicare is not going to reimburse any of this. Okay, this is not included. This is not considered anything medical, psychiatric, rehab, any of that. So Medicare is not going to pay for any of those services. What does pay for those services will be some Medicaid, and then there are other grants that the states are provided so that they can kind of allocate that money and help, in certain ways. Also, this is also going to be paid for by the, the patient, the money that they have, like their personal resources, and maybe long-term care insurance and things like that. And then we have skilled nursing services. So skilled nursing, this is where a nurse would come to the home and provide you your service right there directly to the patient. Okay, so it could be, to monitor you, set up monitoring equipment. It could be maybe to render your infusion of whatever medication you require, or anything like that. So this would be something that Medicare does pay for, okay, because it's being provided for by a nurse. a skilled nurse who is licensed and allowed to accept Medicare. Okay, so more services in home care. So physician services, sometimes physicians actually do make house calls. It's rare now, but they used to do it a lot back in the day. Also, physician assistants or non-physician practitioners, they can also make home visits to treat the patient under the supervision of a physician. And then there's also physical, speech, and occupational therapists. Okay, so this is your rehab stuff. Physician services, of course, that will be covered by Medicare. Same thing with this rehab stuff. Okay, so in general, better and quicker results come from home visits, of course. They are also less costly as well. And the therapist develops a plan here. They're going to teach the patient and caregiver and what they need to do, and then monitor with regular home visits. Okay. So then we have emergency response services and telephone and visiting programs. So emergency response services. This is an electric response. Maybe the older adult has a button that they can press for emergencies like life alert. Okay. Also personal responses. Maybe a friend calls at a prearranged time each day just to check up on the older adult and see how they're doing. Maybe just to make sure that they're okay, they haven't fallen or anything has happened. This is not going to be covered by Medicare. Okay. Okay. So telephone and visiting programs help with. This would include help with isolation issues of homebound older adults. As well as visitors that come, they're going to be trained to notice health problems, environmental dangers, things like that. So they'll be able to spot out maybe like, something could be a hazard, where it could be, they could see something that the older adult can't see, and that maybe, something might be really easy for them to fall over, or they could notice that there are some areas of the home that are very not clean at all, which could cause infection later in the older adult. So this is just good to kind of just make sure the home is safe and that, the older adult is all good. This is not going to be covered by Medicare. Okay, so home delivered meals and hospice care. So home delivered meals, I'm sure a lot of you have heard of the Meals on Wheels program. This is where they deliver hot meals to older adults 5 times a week, once a day, and this is great so that the older adult is not malnourished, okay? Because many can't have a really difficult time cooking their own meals and staying healthy and all that. So what this does is it makes sure that they're fed, they're getting a decent amount of nutrition every single day, or most days. Hospice care. I think we all are kind of familiar with hospice. So this is usually provided at home, but it can also be provided in hospitals. And to even be able to receive hospice care, you have to be diagnosed with only 6 months or less to live. Okay. And then Medicare will reimburse for hospice services. Okay, so now let's look at community-based services. Okay, these are the ones that Medicare prefers us to use, but will not pay for. So first of all, we have congregate meal services. This is really great. It's kind of like Meals on Wheels, but not really, because what this is they're bringing the meals, the hot meals, to maybe like a rec center or a senior center or an adult daycare or something like that, where older adults congregate, and this way they can all have a nice hot meal, okay, that of course is going to meet all the nutrition requirements and make sure that the older adults are fed and that they're able to have enough nutrition in their bodies. Okay, The funding for this type of a program is going to come from Administration on Aging. This allows older adults a social meal and also includes transportation. So sometimes they will come to the older adult's home, bring them to the place, and then they can socialize with their friends, eat their hot meal, and do things like that. This can be prepared with special dietary needs as well. Okay, then we have adult daycare centers and adult day health centers. So a lot of these different programs will include special programs for those who have Alzheimer's or dementia. Most of these programs are going to be covered through Medicaid or even the Older Americans Act. And many communities do not have a lot of these centers. This is usually in areas where there are more people. Okay, so next we're going to look at multi-purpose senior centers and then transportation services. So multi-purpose senior centers. These are recreational places like rec centers. This is where they can do activities, they can get educated on, health problems. This usually helps to meet the community's needs. So whatever the older adult community needs, then it's catered to them. Okay, activities are going to be varied, so different stuff, different times at different places. Services that are usually provided at these multipurpose senior centers are going to be, of course, information on health issues and things like that, as well as congregate meals. So they do get to eat for free, get like a nice, good, hearty meal out of this. So then we have transportation services. So this is definitely necessary for many older adults to attend social and cultural events. Okay, and while it can be really difficult for the older adult to even get to the place where they need to go because maybe they don't have transportation, and public transportation does not always serve those who are very frail or those who have wheelchairs. They don't really take the time to really help those older adults in public transportation. So it can get really difficult for them. It can be hard to navigate, especially if they have a lot of equipment that they need to bring along. So transportation services can be a great part of other of these community-based programs. Next, we'll look at case management services and comprehensive community-based care. So case management services. This is where a case manager is going to figure out exactly, is going to analyze the older adult and figure out exactly what they require, what services they need, what's going to really help them the most, and also take in consideration what they have to pay this. How is it going to be funded? And what programs do they qualify for? What are they eligible for? What funding are they eligible for that will allow them to receive certain services that they're going to need? So the case management services are usually to help connect the older adult to the services that they can get to really help benefit their life. Then comprehensive-based community-based care. So the program, or PACE, is the Program of All-Inclusive Care of the Elderly. So this is also similar to a case management service. It helps older adults who have been certified as eligible, for nursing home admission to enter into a long-term care program and also remain at the home. Usually this is because those older adults might be a bit more frail, and also they might not have all the cash to go into an expensive facility. So this will allow them to maintain some level of functionality, if possible, while they're able to receive all their services in the home. So, community-based shelter living. So some older adults who need assistance, but not necessarily 24-hour nursing care, this is for them. So there are different levels of care that are going to be provided. Licensing and cost may vary. Because some places may not actually offer a lot of serve a lot of the different levels of care services. Some places may offer a variety of different levels of care services. Some that don't offer very many levels of care, they may only offer personal and custodial levels of care. These places are probably not going to be licensed because you usually don't have to be required to be licensed. Okay, and then those who are going to offer different levels of care, they're going to be licensed by the state, and also I'm sure they will definitely want to be certified to accept Medicare so that they can provide medical services and nursing services to the patients. So anyway, many of these houses, these would be like your group homes, your boarding houses, adult foster care, assisted living, continuing care, retirement communities, things like that. Nursing homes. So 24-hour, this is where you're going to get your 24-hour nursing care, your short-term nursing care, your long-term nursing care. Okay, it's going to be very similar to hospitals, but it's not a hospital. Okay, so usually in these nursing homes, they'll offer activities, but they're also going to offer assistance with your, everyday living. And they're also going to give you therapy and more than likely medical services because you're a part of a 24-hour care system. So each facility is going to vary in price, the level of care that they provide you, the size, and all that. Nursing assistants are going to be the majority of the staff, so CNAs. There are going to be RNs, LVNs, so they will have nurses to provide medical care and will contact physicians when it's going to be needed. So the nursing home population, 1.5 million residents are housed in nursing homes, so it's quite a bit. 90% of the people who live in nursing homes are 65 and older, and about 75% of the people who live in these nursing homes are women and they're not married. More than likely, this is because, women usually outlive the men, especially in, later on in old age. So, many of these women are going to be widowed, and that's why they're unmarried, and there are more women than men. The people that live in these nursing homes, cannot perform tasks of daily living and have no help, like no family, no relatives, no friends, or anyone at home to take care of them. Many ethnic groups are completely underrepresented in these homes. It's usually, like I said, many ethnic groups, a lot of ethnic older adults do not even bother with these kind of nursing homes, and they typically will stay at home with their families. Usually those who are from many different ethnic groups, family is like the center of everything. So it's a little bit different from people who are just very American. The family structure is a little bit different. Usually in more ethnic groups, family will take on that responsibility, and not so much in like American families. So the nursing home costs. Nursing homes are extremely expensive. For one individual, and the average cost could be close to $100,000 a year. So many older adults enter a nursing home with Medicare as their primary funding because, of course, Medicare is definitely going to cover nursing home services because nursing homes, they provide medical care, and they provide rehab and things like that. So Medicare usually is the primary funding, and that's how they enter. However, at a certain point, they may exhaust all the Medicare services that are offered, and they may have to use cash when they're no longer eligible for Medicare to cover certain expenses in that nursing home. And also, many will move to Medicaid as well when their personal assets, their cash, and all that is depleted. Okay, so then they start applying for Medicaid, and then Medicaid will have to start covering their costs. So Medicaid pays like pennies, okay? They pay less per day than the actual cost of the services. So most of these facilities who accept Medicaid are going to lose money. Okay, they're always at a loss. Non-Medicaid patients, of course, are going to pay a whole lot more. Okay, they'll usually pay the full price. All right, so nursing home regulations. The nursing home regulations that are out there, they address physical, medical, and psychological well-being of the resident. Okay, they like to see the individual, the patient, as like a whole being, not just focusing on the physical symptoms. So that's a good thing. Nursing homes cannot receive payment from Medicare or Medicaid without being subjected to these regulations and inspections. That's part of being certified. So what happens is many of these nursing homes are going to be visited by peer review organizations. Agents from these peer review organizations are going to come there, and they're going to look at all the different cases that these nursing homes have, and they're going to go through all the services that have been provided for these patients, and they're going to check to make sure that quality and the standards and everything are just on point. Okay, because there actually is a lot of fraud and abuse going on in nursing homes, especially those that accept Medicare and Medicaid, because of course Medicare and Medicaid don't pay very well. So if they do accept Medicare and Medicaid, the agents from the peer review organizations will come and check up on them, make sure that they're abiding by all the regulations, all the standards, everything, so that they can keep their certification and they can keep caring for patients that have Medicare and Medicaid. Okay, many states also have their own regulations as well, and when they do have their regulations, they're usually a bit more strict than the federal regulations. Okay. So nursing homes, the minimum data set, MDS. These are assessments of each resident submitted to the federal government and completed by staff who work with the patient. Okay, so the MDSs help determine Medicare reimbursement rate. This helps determine how much the facilities get paid, okay, for their services for these older adults. So it includes info on health, well-being, function, risk factors, and their care plan. Okay. So individual care plans. The data from the MDS will help determine the care plan for each resident. Okay, so the care plan takes information from the entire interdisciplinary team. Okay, that's the physician, the nurses, everyone who's taking care of that patient, especially on the, in that nursing home, all the people that have that patient's case. So take all the information from them, as well as the information from the resident, okay, the patient and the patient's family. And then these care plans have to be updated frequently with any new conditions that the patient might develop. Okay, so some selected areas of concern. There are physical restraints, and then there are chemical restraints. So let's look at physical restraints. These restraints cannot be used for convenience or discipline. You can only use a physical restraint on a patient if it has a medical use. Okay, if you're doing it to just punish a patient for not being compliant, not doing what you say, not going to nap time when it's nap time or whatever, that's bad. Okay, so physical restraints that's abuse. Physical restraints can only be used if it has a medical use. Restraints use must be monitored, and there must be efforts to discontinue this kind of use as well, because no one should be restrained, okay, if they don't have to be. There are no regulations on restraints in the home, though. This is all for nursing homes. So chemical restraints. So this is when they give psychoactive drugs and sedatives and things like that. to the patient because maybe they're acting up, maybe they're being, maybe they're being, maybe they have some form of psychosis or something is going on with them, and they can't calm down, or something is happening. So in order to get hold of the patient and to control the situation so the patient doesn't hurt himself or anyone else, usually they will have the patient take some sort of psychoactive drug, sedative, or something like that. So the dose has to be reduced every few months unless there is a medical reason to not reduce this dosage, because it is risky. I mean, patients can become dependent on these drugs. So when you do have to use them, you can use them, but you have to have a plan to reduce them and to get the patient off of them. Unless there is like an actual reason for why you should not take the patient off of this medication. So all of this has to be completely recorded and monitored. Okay, so areas of concern, there are pressure ulcers and also institutional elder abuse. So let's look at pressure ulcers. One of the most common reasons for lawsuits are pressure ulcers, believe it or not. There are many regulations for treatment and prevention of pressure ulcers, and this happens a lot in like bed-bound patients, because in many older adults, especially when they are in a nursing home, they're bed-bound. Okay, so if they're laying in their bed all day, they're gonna have pressure ulcers develop, like in their back, in their booty, their legs, all of that, right? Because they're putting a lot of pressure on those areas. Well, what the hospital, what the nursing staff or whoever's working with them in the nursing homes, they're supposed to be rotating them. They're supposed to be moving them around so that they don't stay in one position and get pressure ulcers, because when you do, of course they're painful, but now you're at risk for infection, okay? So of course that would definitely be a malpractice lawsuit. Also, institutional older adult abuse. Healthcare providers must report any kind of suspected elder abuse. They should be careful in screening of employees, okay, and to try to help eliminate any kind of older abuse. A nursing home should also have many visitors, and they should be screening a lot of the visitors as well. So anyway, then we have benefits and limitations of nursing home care. So looking at the benefits, it's great. There's 24-hour medical supervision for the older adults, centralized coordinated care. There's a lot of social interaction. They can be around friends. They can, do everything. They have activities usually. So there are opportunities for them to have fun, relax, and be well taken care of course. This is federally regulated. There are, if Medicare is going to cover this, there are certain standards that every place is going to have to abide by. These type of facilities have to be licensed by the state, so again, it is regulated. They tend to be very safe, secure places for older adults. Some limitations that you have in a nursing home care center would be keeping qualified staff, especially nurse aides. So sometimes it's difficult to keep qualified staff to retain them, okay? Because there can be burnout. They might feel that they're not being paid enough, okay? They're especially with nurses, of course, nurse aides as well. There's high job dissatisfaction among this group. So also the atmosphere may feel like a hospital instead of a home. So it might not feel very personal. It might not feel just, very bright and happy. Sometimes there can be too much care, okay? And too much care can help the older adult lose a lot of their function a lot quicker, okay? Because if you're enabling the older adult and not letting them do the things that they can do, then that's That's just gonna allow them to deteriorate a lot quicker. Also, there's a loss of individuality at these type of places. Because many of the patients, especially in large facilities, they're just another patient. Okay, so there isn't much connection and treating everyone as more of an individual rather than just, another patient, and all the patients are the same. All right, so nursing homes. We have new directions in nursing homes, and then nursing home advocacy. So new directions in nursing homes. Okay, so new directions. Which way should we move in the whole nursing home direction? How can we make this better? So a huge thing, yes, another problem that we saw on the previous slide is that a lot of these nursing homes, they do not really focus on individuality or anything like that. And there isn't much of a connection. They don't, it's more of like, they're just patients. Okay. So the future of nursing home, where we want to go to kind of make it more of a healthier environment, we need to focus more on relationships, and also we should try to find a right institution for the older adult, because they're all going to be a little bit different. You shouldn't just throw them in any old one. Pick the one that fits the older adult. So what the Eden alternative is the Eden alternative focuses on moving away from the normal institutional hierarchical medical model of care into more of a constructive culture of home where older adults can direct their own lives. Okay, so they can do their own thing. We can focus on the care of the human. We can focus on spirituality for the patient. You can focus on their physical symptoms and the whole individual as a whole. Okay, so nursing home advocacy. The Nursing Home Reform Act of 1987 requires that certain rights to those who use Medicare and Medicaid. Okay, so there are certain rights that people who use Medicare and Medicaid are entitled to. Okay, next one. Okay, so assessing assessing nursing home quality. So the government measures quality, right? And they do that. And the way that they're able to regulate is because they regulate Medicare and Medicaid. And since all older adults receive Medicare and many older adults have Medicaid benefits, and in order for a facility to even be able to accept Medicare and Medicaid benefit or reimbursements and to be able to care for those patients, they have to start abiding by Medicare and Medicaid rules. So of course the government would have those measures of quality. So the government typically will have certain staffing ratios that are set. So you usually have certain hours per patient day that are required in these nursing homes and use that to sort of determine the quality of the care that is being provided to the patients. All right, so planning for long-term care. When one plans for long-term care, way ahead of time, usually once you're at that age where you require long-term care, it's a much smoother transition. Okay, so what you should do is look at all your options, including financing, before the need even arises. Okay, sometimes many older adults will opt for a reverse mortgage. Okay, so that'll help with a lot of the financing. And what that is like if they already completely own their home, like they don't pay a mortgage anymore, they can do a reverse mortgage. And that's the basic idea behind that, is like the bank is buying your home. Okay, so like they'll pay you the money monthly so that they can, start owning your home back. And you can use that money, since you don't owe it like on the house anymore. Okay, now you're letting the bank own some of your house, and they're paying you some mortgage. You can use that money to help, pay your bills, to pay for your food, and also pay for your services. Okay, so anyway, you should, and some more planning for long-term care. You should visit all potential nursing homes in the area. Visit during meal times and whatnot, so that you can be able to talk to the different residents who are there, and that way you can see if it would be a good fit for you if you wish to, move into those homes. Also, it's a good idea to just visit websites, okay? Learn more, and also look at reviews, okay? And then compare the different reviews, because many times websites and whatnot, they'll make everything look amazing, but if you look at different reviews and what people are actually saying, then you can get a better idea if it might be a good fit for you without having to go there. Although going there, nothing really beats that. But anyway, this is the end of lesson 14, and I hope you learned a lot. If you have any questions about this material, please let me know. Comments, emails, whatever. I'll see you guys in the next lesson.